Welcome, everybody. It's good to connect. It's good to see you. My name is Catherine Sisk, and I'm the Program Coordinator for Justice Ministries in the Presbyterian Church in Canada. I'd like to thank you for joining us today. Just going to encourage my computer to do something here. Just a couple of housekeeping notes. This webinar is indeed being recorded. So when you join us, and I think most of you have your cameras off, this webinar is being recorded and it's going to be posted on YouTube afterwards. So if you would like just to keep your camera off, that would be good for that. And keep your microphone muted just so that we don't get a lot of background feedback, excuse me. We're going to be talking about things that can provoke anxiety. So I hope that you'll take the time to check out Monday's webinar from Justice Ministries on fear and justice in a time of pandemic, because there's some great advice there about how we can think about our anxieties during this time. And then on Wednesday's webinar, which are both on the Presbyterian Church's website and on YouTube, about self-care. And that will give you some great advice on how to cope with anxieties in this time of pandemic. I am indeed working from home. And so just some housekeeping notes from me. My son's daycare is shut down, like so many people out there. So my family is home as well. So you may hear some noises from a toddler in the background. I do ask your patience for that. He is napping right now, but I don't know how long that will go on for. So I suspect that we won't hear from him, but if you do hear baby or toddler noises, I will do my best to minimize that. But that is my reality working from home right now. I also am next door to a construction site right now. So if you hear some buzzing that in the background, it's noise from next door. So as I said, I will try to minimize that, but we'll do what we can. These are the realities of the pandemic right now. I've listed some objectives for our webinar today. Among them, I would like to connect. In this time of social distancing. That's part of the reason we're offering these webinars is as a way to stay in touch with each other. This webinar is about vulnerability and justice in a time of pandemic. And so one of our objectives is to understand and identify vulnerable communities related to COVID. And then to talk a little bit about responses that are based in empathy, love, inclusion in this time of social distancing. So near the end of our, I'll talk a little bit about vulnerability, giving it some definition. We'll look at some communities that might be considered vulnerable in this time of pandemic, and then we'll have a bit of reflection and discussion about what Scripture tells us about justice and vulnerability, and we'll finish up with a discussion about what you think our justice calling is in this time of pandemic. I'd like to open with a prayer, and this prayer is a reading of Psalm 95, 1-7, and I'd like to thank Amanda Curry, the moderator, for this reference. This was the psalm that she used for her prayer during a time of pandemic, which you can find on the church's website. So let us pray. Oh, come, let us sing to the Lord. Let us make a joyful noise to the rock of our salvation. Let us come into his presence with thanksgiving. Let us make a joyful noise to him with songs of praise. For the Lord is a great God and a great King above all gods. In his hand are the depths of the earth. The heights of the mountains are also his. The sea is his, for he made it, and the dry land which his hands have formed. O come, let us worship and bow down. Let us kneel before the Lord our Maker, for he is our God, and we are the people of his pasture and the sheep of his hand. Amen. So I'd like to start with a reflection question, and this is mostly, I think, for self-reflection. But if you feel comfortable sharing, then I would invite you to do so in the chat box, in the chat feature. But I just want to start with a general question. Can you think of a time when you were vulnerable? And you don't have to put any definition on what vulnerable means to you. Just think of a time when you were vulnerable. And I'd like you to think of two specific things. What did that look like? What were the what was the situation like? And how did you feel? How did you feel in that moment? Like I said, some of these moments might be quite personal, and so you don't have to share them. But if you do, you can just share it in the chat feature. Think of a moment when you were vulnerable. What did it look like, and what did it feel like? I'll read some of the reflections as they come up. When I left my marriage and tried to restart life on a part-time salary, I was terrified. I can't imagine. That would be very, very vulnerable indeed. Thank you for sharing that. I'll share a time when I lost my grandfather. I will share one of my own. I was in a car accident several years ago, and I had moments after that when certain images or certain experiences would invoke flashbacks for me. And so that was and I was never sure when I would have flashbacks. So that was a very vulnerable time for me. When my husband died, leaving me a single parent with 2 young kids. These are very brave sharings, and I want to thank everybody for being brave and for being open and for sharing these moments. What does it mean? One more. When I was preparing for surgery and completely in the hand of healthcare workers, I felt cared for and protected and safe. That would be very vulnerable. And it was good that that caregivers made you feel safe. Vulnerability can be a very subjective thing. And before we talk about defining vulnerability from a more specific context, there's a couple of general contexts that I would like to touch base on because they'll be very familiar, but they're sort of outside the scope of what we're going to be looking at in a bit. One space of vulnerability. Sorry, I'm just going to close the window there. One concept of vulnerability, which falls outside what we're going to talk about, but is very close to in terms of risk, is environmental hazards. And this would be the case, for example, if you lived on a floodplain, or if you lived on or close to the side of a mountain where there were frequent mudslides or avalanches. That it's a concept that's used a lot in emergency preparedness, and it's usually often linked to natural disasters. Another popular reference to vulnerability is one that you might find and be familiar with, is Brené Brown's treatise on wholehearted living. Brené Brown is a psychologist and a social worker and a researcher and writer. And she has a very popular TED Talk on what she calls wholehearted living, in which she talks about vulnerability as a mentality for mindfulness and for building healthy connections with others. And I love Brené Brown, but what she's talking about sort of falls outside of the scope of what I'd like to address today. But those were two kinds of vulnerability that I know a lot of people would think of. So it bears stating them, but then we'll put those aside and we'll move on to defining vulnerability in sort of a public policy or a public sphere. It's important to say that the areas that you'll see on your screen is certainly not an exhaustive list. These are just areas or categories that might have something specific to say about how we define vulnerability in public policies and programs. So for health and healthcare, those with particular health conditions, in the context of COVID, for example, you'll have this in health conditions or situations. You might have an increased likelihood of needing medical care or medical intervention. So in COVID, that would be elderly people, people with pre-existing medical conditions, especially respiratory conditions, or those with a compromised immune system. These are some of the health-related vulnerabilities that we might think of. And again, also, I've defined that differently than healthcare, which in a COVID context could be frontline workers, first responders, doctors, nurses, assisted living caregivers. These are the kinds of people who, due to their professional responsibilities, cannot practice social distancing. Now, in law, this is a bit of an abstract academic sphere. There's a movement in legal studies that links vulnerability and ethics to analyze vulnerability in terms of the general human condition. They're calling it a universal vulnerability perspective. And the thesis goes something like this. We're all vulnerable by virtue of the fact that we are embodied. We have bodies that are born, that grow, that become frail as it ages, and that eventually die. And the degree of our vulnerability varies at different points in our lives. It's a fairly academic field, and I don't think we need to spend too much time in it, but it's worth saying that there's a very specific context for vulnerability in that kind of sphere. Social care. Now, when I say social care, I do mean things like government support. So particularly social programs and government interventions such as social assistance. That might look like the Canada Child Benefit or other benefits linked to certain economic circumstances related to disability or to economic barriers. Governments will have certain criteria to identify groups who may be eligible for certain benefits. Sometimes accessing these benefits is attached to a list of priorities. And some people may be higher up on those, some people might fall higher up on that list. For example, in terms of providing social housing, this is a situation where the demand for housing is higher than the actual resource. And so there might be a list in which the government has identified priorities or qualities or characteristics of need that will guide access to limited resources. So some people will be higher on that list because they are defined as more vulnerable because of the qualities that they have, because of how the government has identified certain qualities or characteristics of need. Under ability, this collectively refers to people who may have physical, emotional, intellectual, or psychological qualities that impact how they interact with or perceive people and the world. There may be barriers that keep someone from participating in their communities. And those barriers could be physical barriers, that could be stairs or curbs for somebody with physical mobility, with somebody with mobility challenges. It could be a communication barrier, and examples of that would be language or difficulty understanding messages or difficulty reading social cues. There's psychological barriers. That could be someone struggling with dementia. That could be somebody struggling with a mental illness. Another example could be somebody with intellectual challenges or with cognitive impairments. These are all circumstances where there might be public supports and programs available for them. And then under the corrections system. In corrections, this is an interesting one because perceptions of vulnerability can become quite complicated and even contradictory. The term risk here comes into particular focus. When we're talking about risk in public policy, and particularly in this context, controversies can arise can arise when we begin to mix concerns and anxieties about risk to certain groups or risk from certain groups, or perceptions of risk to or perceptions of risk from. Consider the question of vulnerability in these cases where institutions, for example, perhaps a government department or a civil agency like law enforcement, have historically targeted certain groups of people. Perceptions of vulnerability then can become very complicated. To highlight one problematic interaction of risk in this category, consider that Indigenous people are overrepresented in the corrections system. The final report of the National Inquiry into Missing and Murdered Indigenous Women and Girls observes that certain groups, and especially Indigenous women and girls and 2S people, are targeted for, that's the language they use, targeted for violence and experience violence as a result of government policies and programs. So some areas of public policy are more prone to complicated and problematic definitions of vulnerability. So all of this is to say that it's important to define what we mean, to be clear in our definitions. I think this is a good place to pivot into a bit of a different stream and talk about vulnerability in terms of narrative. And what I mean by narratives are stories. How do you tell a story? How do you speak about something? And by this, I understand what are the assumptions that may be connected to vulnerability. Vulnerability can become a label. And can be a force that carries an ethical or a moral perspective. Here's an example of what I'm talking about. Many groups, and governments among them, would classify people in precarious housing situations as vulnerable. Moralizing perspectives often accompany these conversations, whether they're overt or covert. Maybe they're more obvious in some cases than in others. You may have heard the term the deserving poor. Social assistance, for example, has been critiqued by some as creating a culture of dependency. And the underlying assumption here might suggest that some people receiving social assistance lack a work ethic. It creates this story where some people are more deserving of social assistance than other people. Another example is in public policy can tie social benefits to behavioral regulation. And what I mean by that, here's an example of that. There might be conditions under which one has, to go back to our housing example, there might be conditions under which somebody has access to social housing programs, and the access to the housing programs might be tied to refraining from substance use, to participating in counseling programs or in employment programs. These are the kinds of conditions which in which vulnerability can carry behavioral regulations. Canada has a program called Housing First. It was piloted several years ago in several communities, and it places the provision of safe and stable housing as the very first level of need. So there are no conditions on entering into housing. The very first level of need and the most urgent and important factor in this scenario is to get somebody into safe housing. And then from there, once housing is established, once you have a safe home environment, then you can build into it other social programs, which might include employment counseling or treatment for addictions or whatever else. But it takes out that level of behavioral regulation. It puts establishing a safe housing environment as the very first level of need. So in another vein, disability scholars have also noted that discourse on ableism and on vulnerability can become disempowering and patronizing. So that's a discourse where vulnerability can create power imbalances in how people feel and how they're perceived by others. So that's a little bit of a look at vulnerability as a narrative. So let's return to vulnerability in this time of pandemic. The Government of Canada is listing vulnerable populations in related to COVID-19, and there's two ways that they've two lists that they're working from. The first list starts with anyone who is, and these include several biological factors, including older adults and people with underlying medical conditions such as diabetes or respiratory diseases, and people with compromised immune systems. So that would be our little green circle where it's the biological category. The second list that the Government of Canada lists starts with anyone who has. And this is followed by a myriad of circumstantial situation things, which include difficulties with communicating or understanding communication, those facing barriers related to housing or access to medical care, those with economic barriers or difficulty accessing transportation, or those with unstable or inflexible employment conditions. It also highlights those with social or geographic isolation, so fly-in communities or remote communities. That's sort of our bottom circle here, which is sort of the situational sets of circumstances which can contribute to vulnerability in COVID. Now I've added a third circle with a question mark category to represent other factors that might act as a barrier or which might challenge somebody or a group of people. And these factors might be invisible or difficult to qualify or quantify because of their invisibility to others. Mental illness might be one possibility in that category, but there's many others. This Venn diagram isn't supposed to say that there are only three sets of circumstances that can determine the degree of vulnerability, but I'm just using this as a visual prompt, as a visual cue that sort of demonstrates how multiple sets of circumstances can overlap and impact one's vulnerability. So I also want to look at some particular groups that are vulnerable in Canada during the COVID pandemic. One group that has been in the news a lot is Indigenous communities. On Tuesday, the Assembly of First Nations declared a national state of emergency regarding First Nations and COVID-19. They declared their support for individual nations that had previously declared a state of emergency, and even some communities that have enacted travel bans around their communities. Access to healthcare is already critical in First Nations community, and remote and fly-in communities are especially vulnerable to poor healthcare and healthcare services. Some communities lack any kind of permanent healthcare personnel and infrastructure to care for the sick. Hundreds of communities are under water advisories. And as we all know, the first thing that everybody is being told is to wash your hands. Water advisories, there are different levels of water advisories. Some are boil water advisories, in which case, if you have access to running water, you can't drink the water before you boil it. You have to bring it to a boil and then let it cool down for at least a minute, and then let it cool down, and then you can use the water for hand washing, for consumption, for cooking, for bathing, for those kinds of activities. But there are also water advisories that are do not use advisories. And in those cases, those communities are being told to wash their hands with bottled water. So you can imagine some of the difficulties that access to water or lack of access to water can pose. Poor housing conditions and overcrowding also contribute to vulnerability in a time when social distancing is a best practice for preventing the spread of COVID-19. Dr. Shannon MacDonald is the Deputy Chief Medical Officer for the First Nations Health Authority in British Columbia. And she has said that communications also need to be tailored for Indigenous communities regarding COVID-19. And she's noted that emergency language such as words like quarantine, for example, can cause anxiety in survivor of residential schools for whom quarantine had a very specific context and can be a very triggering effect. But there are also First Nations people who have been involved, who had to interact with the Indian hospital system and with sanitariums. And so communication around COVID needs to be very specific and needs to be very cautious because of some of these considerations. The Assembly of First Nations has also stated that there is an immediate need for mental health support for those suffering PTSD, and has asked for emergency intervention from the government for that in that case. And they've also asked for daily tracking of COVID cases in First Nations community. One of the government interactions, particularly for remote communities, has been the use of isolation tents where they don't have health infrastructures where for people, if somebody is diagnosed and they need to go into social isolation, but they don't have any infrastructure for that. They've talked about having isolation tents. And while some First Nations have said, yes, that would work for us, some First Nations have critiqued that and said, in our context, in our environment, there's just no way that that's going to work. So it also points to the idea that responses need to be specific to the needs of a community, because one response is not going to work for all people. It's not a one-size-fits-all situation. The Government of Canada has announced a $305 million support called the Indigenous Communities Support Fund to address immediate needs in these circumstances. It is specific to COVID, and they are still working out the details under which access to that funding will be available. But if you're interested in learning more information about Indigenous communities and COVID, I'd invite you to follow APTN, which is the Aboriginal Peoples Television Network. They have a good and diverse coverage of COVID. The Assembly of First Nations has a ton of information on their website. The Anishinaabe Aski Nation also has an entire section of their website dedicated to COVID, and they represent 49 nations, remote nations in Northern Ontario. You could also check provincial Indigenous health authorities. They have websites that'll have a variety of information that is specific to the Indigenous community. The other thing that's important to note is just the timing of year. There are a lot of First Nation communities, a lot of remote communities that are entering flood and forest fire season. You can remember some of the forest fire situations of last summer and the summer before, and that's an additional level of vulnerability particularly for northern communities. The other population that I'd like to spend a moment thinking about are people who are in incarceration. Incarcerated people are by nature living in very close quarters and have particular kinds of vulnerability to COVID. This is exacerbated in with a low healthcare capacity. It's already under strain and they have limited resources. Some of the government measures for reducing the chance of COVID-19 spreading in prisons have included limiting visitors, screening staff people and other people who have to enter prisons, and restricting social interaction among prisoners. And while these measures of isolating, while these additional measures might limit the risk of COVID spreading, it also has it carries risks of their own in an already isolated population. Mental illness rates are much higher in incarceration populations than in the general public, and the impact of additional measures for physical and social isolation can be quite severe. If you're looking for information on the John Howard Society has a bunch of really good information on their website, and they've been advocating with the government about how best to mitigate some of these vulnerabilities for incarcerated people, and that's included reducing the number of people in prisons, either by expediting releases for those who have been recommended for parole, and for those approaching their statutory release date. They've also advocated for measures of protecting people who are incarcerated who have physical ailments that might put them at a high degree of risk, a high degree of risk to their health if they were to contract the virus, including, in some cases, moving people from prisons into situations of house arrest with increased monitoring with family members who would receive them. There's a lot more that could be said about vulnerability in these circumstances, but those highlight some that are very specific to the COVID outbreak. I've been doing a lot of talking. You've listened to me for the last half hour. I'm going to open up the floor. I would like for us to spend a little bit of time thinking about the Bible now. And so the question that I would pose to you is, what scripture passages, stories, or images do you think of in relation to justice and vulnerability? So if you could type into the chat bar anything that comes to mind. Is there a verse, a story, an image a biblical story or a biblical verse or a biblical image that resonates with you, that brings together this notion of justice and vulnerability? One story that I was speaking with somebody and that they brought to mind was when the Israelites were during Passover, when God said to them, "Stay home, stay home. The angel is coming, and you have to stay home. Mark your doors with blood and stay home." I'm seeing a couple of responses on the chat line now. The Good Samaritan story brings together the issues of vulnerability and justice. The woman with the issue of blood. The woman in Matthew 25:31-46. Jesus making sure that all were fed by allowing the gathering in the fields on the Sabbath. The blind person. Ruth and Boaz. These are all powerful images and stories where there's some very obvious vulnerability. Some are more obvious, some degrees of vulnerability are maybe more obvious in some cases than in others, but also that bring up questions about justice. Thank you for sharing that. That was some good brainstorming. The passage that I'd like to spend a few minutes with are the Beatitudes. And so I'm just they're up on your screen now, and I'm going to read them out loud so that we can have a sound prompt as well as a visual prompt with these. Blessed are the poor in spirit, for theirs is the kingdom of heaven. Blessed are those who mourn, for they will be comforted. Blessed are the meek, for they will inherit the earth. Blessed are those who hunger and thirst for righteousness, for they will be filled. Blessed are the merciful, for they will receive mercy. Blessed are the pure in heart, for they will see God. Blessed are the peacemakers, for they will be called children of God. Blessed are those who are persecuted for righteousness' sake, for theirs is the kingdom of heaven. Blessed are you when people revile you and persecute you and utter all kinds of evil against you falsely on my account. Rejoice and be glad, for your reward is great in heaven, for in the same way they persecuted the prophets who were before you. Somebody has shared, what does the Lord require of you? To act justly, to love mercy, and to walk humbly with your God. That is a very powerful justice passage. Thank you for sharing that. The Beatitudes were the first recorded public teaching of Jesus in Matthew. They set a stage. The Jewish Messiah was expected to be a liberator for the oppressed people of Israel. People expected a warrior, a king, not a baby, not someone who hung out with sinners, and not somebody who used words instead of a sword. The Beatitudes is one of the very first public upsets of this expectation. This context helped prepare me for a new kind of reading on the Beatitudes. I've always been uncomfortable with this passage. I wasn't sure what a beatitude was or what precisely was supposed to be meant by blessing. The Greek can be translated as happy, or the Greek translation of blessing can be translated as happy or evoking of felicity. That reading has never resonated with me and was part of the problem with this was that some of those named blessings in the Beatitudes feel very counterintuitive. Blessed are those who mourn? What is that supposed to mean? What's that supposed to mean for someone who's lost something dear, or a person, someone? Blessed are the poor of heart? That beatitude, coupled with passages in the Bible that say you will always have the poor with you, have been used to justify and ignore systemic injustice. Some time ago, I was reading a commentary on Psalm 1, in which the English translation of blessing goes back to a Hebrew word, and that Hebrew word is ashar, and the English translation of that can be understood as to find the right road. If I think about the Beatitudes in those terms, or that as is a way of seeking a right relationship, then I see this passage in a different light. And I can think of the Beatitudes as supposed to make us question our expectations of who are the citizens of God's kingdom. What are their qualities? What are their gifts? What are their challenges? The power of the Beatitudes then, I think, is that they invite us into a loving relationship with God through people who might surprise us, who might challenge us, who might upset or even upend our expectations, and people who might pull us out of our comfort zones. The name of vulnerable people, Jesus names vulnerable people as beloved of God and centers the kingdom of God around them. What does justice look like? I'm going to open that up for. I'm going to open that one up to you for your thoughts. We've been kicked off with a great justice passage, which what does the Lord require of us? To love mercy, to walk humbly with your God. What does justice look like? What do you think it looks like? Providing for the poor and those without anything to call their own. Thank you for that. Equality. Respect. Breaking down the power structures in our society that oppress people. Visibility. Often the vulnerable are completely overlooked. A balancing of resources. Equity for all. Some people need more help than others. Yes, there's a difference between equality and equity. A good a visual on that is getting a pair of shoes. Equality would be everybody gets a pair of shoes, whether they fit or not. Equity would look more like you get a pair of shoes that fits you and that fit your feet. Seeing the other as Christ sees them. Ensuring the well-being and humanity of all. These are great. These are some very powerful images and some very wise words. seeing Jesus in the other. Listening to needs and learning from those experiencing them. Yes, often the needs of and solutions for different kinds of needs come from the people experiencing them. That's squarely a source of wisdom that is too often overlooked. What does justice look like? Well, there's lots of also mental health for all, mental health care for all. Thank you for that. Thank you for that. There's lots of good scripture around justice, but the text that is up on your screen is a statement on justice that is biblically based and is in a document called Living Faith, which is a subordinate standard of the Presbyterian Church in Canada. So this is a summary statement of what Presbyterians have said about what justice looks like. God is always calling the church to seek that justice in the world which reflects the divine righteousness revealed in the Bible. God's justice is seen when we deal fairly with each other and strive to change customs and practices that oppress and enslave others. Justice involves protecting the rights of others. It protects against everything that destroys human dignity. Justice requires concern for the poor of the world. It seeks the best way to create well-being in every society. It is concerned about employment, education, and health, as well as rights and responsibilities. Justice seeks fairness in society. It involves the protection of human beings, concern for the victims of crime as well as offenders. It requires fair laws, justly administered, courts and penal institutions that are just and humane. Justice opposes prejudice in every form. It rejects discrimination on the grounds of race, sex, age, status, or handicap. Justice stands with our neighbors in their struggle for dignity and respect and demands the exercise of power for the common good. And that's section 8.4, titled Justice, under Living Faith, and that can be found on the Presbyterian Church's website. It's a subordinate standard of the church, which means that it has been approved by General Assembly and is one of the foundational documents of the Presbyterian Church. I do note that a lot of the comments that we've seen in the chat bar echo strongly some of the images and some of the wording that's in this statement. Is there anything here that surprises you? Is there anything here that stands out to you? I'd invite you to share that in the chat bar. Any particular aspect of justice that resonates with you particularly right now? There's a lot of text there. The word human dignity I think resonates very strongly with me. Sexual orientation is missing from grounds of discrimination. Thank you for that. Thank you for sharing that. seeks the best way to create well-being in society. Yes, this is a good and helpful guiding statement for justice, but it is certainly not the only things for justice. This is maybe we could look at this statement as a place to start, but it certainly does not encompass all aspects of justice, and it is itself bound in a time bound into the time and context in which it was written. Yeah, it doesn't talk about privilege. Our society privileges some groups against others. That's very true. Yes, it is a human-centric statement. It doesn't look entirely at the lens of all creation. So aspects, say, of ecological or climate justice are not present in this. Thank you for that observation. So it's kind of interesting that while this says a lot, it certainly does not cover all aspects of justice, and while it can help us start to begin to think about what justice means, it's also helpful as a place to look where there are gaps, because there are aspects of justice in our context today which this clearly doesn't speak to or does not name. Is there any final thoughts on this? Either something that doesn't resonate with you, a gap in this statement, or something that resonates quite strongly with you, particularly in this time of pandemic? Let's move on to one final aspect of our time together. During the COVID-19 pandemic, where do you hear or see calls for justice? Where do you see or hear responses to justice? Got some comments here, creating well-being in every society. And I think justice in this pandemic particularly needs to address the issues of the poor, homeless, and families in abusive situations. Thank you for that offering. One thing that has become quite clear when we're talking about vulnerability in the time of pandemic is that already vulnerable communities that were vulnerable for whatever reason before the pandemic can compound those issues. And so it is addressing vulnerability in a time of COVID can't just be linked to addressing the spread of the virus or addressing the healthcare needs of those who get sick. There are systemic issues that are linked to human health and well-being that need to be a part of responses to responding to pandemic. Thank you for that sharing. Is there something that you've seen in the last few days or weeks that has called out to you and says, this is a situation of injustice that you want to name here? A lot of elderly are being shut up in nursing homes and cannot be with family. That's got to be such a huge challenge. And indeed, we're finding that a lot of the deaths related to COVID are actually taking place for people who are living in nursing homes and in assisted living facilities. So that's a very, very difficult situation. Calling for the end of hoarding and price gouging. I'm sure everybody has experienced going to a supermarket and not being able to find staple goods that they need for their daily living, particularly when their daily living is in their home environment, whatever that looks like. Oh, those who have lost loved ones and cannot properly grieve or be supported. That is a big vulnerability. I can't imagine how difficult it would be to be disconnected physically from people in a time of such extreme vulnerability. Thank you for sharing that. And these are situations that I think to some degree, many of us can connect with a lot of these issues. Where have you seen or heard responses to them? Where have you seen or heard responses? How have you responded? How has your church community responded? How has another community that you read about online responded? Our church is phoning shut-ins to see that they are okay. Great, wonderful. Just watched a live stream funeral for my nephew's fiance. I am so sorry to hear that. Where churches and communities are trying to help with feeding the poor, supporting healthcare workers. Those are very positive responses where churches and community groups are being very helpful and responding to needs as they arise. People are lighting candles in hopes of putting them in their, and people are lighting candles of hope and putting them in their windows. Our church partners with other organizations offer free lunch 1 day per week. Now, instead of a sit-down meal, we are making deliveries. So there's a great example of how a church that is already doing community work has just adapted what they do to a pandemic context. There are Facebook groups forming to help others with shopping, etc. These are all really, like, this is hope building for me, and it is so important that we focus on hope in these times because it is so easy to get bogged down in fear and anxiety. So thank you for being part of this hope sharing. Here's just a few examples that I found online when I started looking for how our community is responding. The top one says caremongering. There's this movement of groups calling themselves caremongers, and they're regional. So the example I pulled up is a public Facebook group that's calling themselves caremongering in the Calgary area. And somebody just posted a message that says, I'm available for grocery runs and errands. DM me, which means direct message me. So if you need something, I've got a car and I can go out and I can get stuff for you if you're, for example, in self-isolation. Another wonderful, this was also from the one on the right is also a Facebook posting in a public group that was set up within a Jewish community. And it says, help me please, for those of you who are willing, I need you to help me maintain my sanity. I understand that for many, it's not only inconvenient, but unsafe to go to shopping centers. And then he goes on to say that I need something to do and I can deliver your groceries for you or whatever it is you need. So the level of community response is really, really heartening. The other thing that I wanted to highlight just at the bottom is the Canadian Muslim Response Network. It's also a public space. And what I wanted to highlight in this is not just how much civil society groups are responding, but faith groups are responding. And interfaith responses are really quite powerful to see. So here's some resources. Presbyterian resources. There's a page on the Presbyterian Church's website that is dedicated to the COVID-19. It will have resources including the webinars that have been on this week, fear and justice in a time of pandemic, self-care and justice in a time of pandemic, and then of course this webinar will also be posted there. There are resources for congregations. There are resources on worship in this context, and a lot of really good information that's relevant to the Presbyterian Church in Canada. CPJ's website, the second list is Citizens for Public Justice. That's what that acronym stands for. And they have a 8-page document that lists connections for local groups all across the country. It's just a laundry list of groups, and it's divided by geography. So if you're living in Vancouver, if you're living in Truro, go and see if your community has a group, and if you want to start one, you can add your group to that list if it's not already up there. And a list of spiritual resources that I found helpful is on there. That's daily reflections, prayers, personal biblical reflections on pandemic that people can use if they're needing some spiritual resources right now. Oh, somebody has said CPJ is a great faith-based organization for justice issues. Check them out. They're wonderful. They are a non-denominational Christian organization that advocates for justice on a wide variety of issues, from poverty to ecological justice, and they have wonderful resources, and they do have a bunch of resources dedicated to pandemic in a Canadian context. So they are a great organization. Check them out. So we're 3 minutes out from the end of our conversation. I want to say thank you so much for joining us today. This has been a really, it's been great to see all of the reflections and advice that people are sharing in the chat functions. We are going to continue as Justice Ministries to offer webinars on justice issues over the next however time period. We're also going to look at different ways that we can connect in a digital format, maybe some that are more interactive than others. If there are ways that Justice Ministries can support you in this time of pandemic, please contact us. We would love to hear from you. Maybe Kara, if you could pop the Justice website and up on the email for Justice Ministries up on the chat feature, that'd be great. I'd love to close with some words from a writer in the Sojourners magazine, which is an American Christian magazine. COVID-19 forces us to push back against the narrative of individualism and remember that we all depend on each other. In the face of this, churches can mobilize to meet both the physical and emotional needs of their congregants and their communities, as well as to practice the perspective of putting the most marginalized, vulnerable folks at the center of decision-making. This pandemic will reveal who we are. Hopefully, it will reveal that we are love. Go in love. That is my blessing to you. Go in love, go in health, go and connect with others even in this time of physical distancing. May that not also be social distancing, but physical distancing. Thank you so much for joining us.
Thank you, Catherine.